Rabeprazole is a proton pump inhibitor used to help gastrointestinal ulcers heal, to treat symptoms of gastroesophageal reflux disease, GERD, to eradicate Helicobacter pylori, and to treat hypersecretory conditions such as Zollinger-Ellison Syndrome. In this video, let's find found. What is rabeprazole? What is rabeprazole used for? Contraindication. What are the side effects of taking rabeprazole? How does rabeprazole work? How to use rabeprazole? What is rabeprazole? Rabeprazole, sold under the brand name Aciphex, among others, is a medication that decreases stomach acid. It is used to treat peptic ulcer disease, gastroesophageal reflux disease, and excess stomach acid production, such as in Zollinger-Ellison Syndrome. It may also be used in combination with other medications to treat Helicobacter pylori. Effectiveness is similar to other proton pump inhibitors, PPIs. It is taken by mouth. Rabeprazole was patented in 1986 and approved for medical use in 1997. It is available as a generic medication. In 2017, it was the 288th most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is rabeprazole used for? For the treatment of acid reflux disorders, GERD, peptic ulcer disease, H. pylori eradication, and prevention of gastrointestinal bleeds with NSAID use. Contraindication. Aciphex is contraindicated in patients with known hypersensitivity to rabeprazole, substituted benzimidazoles, or to any component of the formulation. Hypersensitivity reactions may include anaphylaxis, anaphylactic shock, angioedema, bronchospasm, acute internal nephritis, and urticaria. Side effects. Side effects of rabeprazole. Headaches. Make sure you rest and drink plenty of fluids. Feeling or being sick, nausea, or vomiting. It may help if you avoid rich or spicy food. Diarrhea. Drink lots of fluids such as water, wash, to avoid dehydration. Constipation, stomach pain, farting, feeling dizzy or tired, sore throat. Pharmacodynamic. Rabeprazole prevents the production of acid in the stomach. It reduces symptoms and prevents injury to the esophagus or stomach in patients with gastroesophageal reflux disease, GERD, or ulcers. Rabeprazole is also useful in conditions that produce too much stomach acid, Zollinger-Ellison Syndrome. Rabeprazole may also be used with antibiotics to get rid of bacteria that are associated with some ulcers. Rabeprazole is a selective and irreversible proton pump inhibitor. Suppresses gastric acid secretion by specific inhibition of the H+, K+ ADPase found at the secretory surface of parietal cells. In doing so, it inhibits the final transport of hydrogen ions, via exchange with potassium ions, into the gastric lumen. Mechanism of action. Rabeprazole belongs to a class of antisecretory compounds, substituted benzimidazole proton pump inhibitors, that do not exhibit anticholinergic or histamine H2 receptor antagonist properties, but suppress gastric acid secretion by inhibiting the gastric H+/K+ ADPase, hydrogen potassium adenosine triphosphatase, at the secretory surface of the gastric parietal cell. Because this enzyme is regarded as the acid, proton, pump within the parietal cell, rabeprazole has been characterized as a gastric proton pump inhibitor. Rabeprazole blocks the final step of gastric accretion. In gastric parietal cells, rabeprazole is protonated, accumulates, and is transformed to an active sulfonamide. When studied in vitro, rabeprazole is chemically activated at pH 1.2 with a half-life of 78 seconds. Half-life: 1 to 2 hours in plasma. Dose: duodenal ulcer. Indicated for short-term, up to 4 weeks, treatment in healing and symptomatic relief of duodenal ulcers. 20 mg PO/Q day after morning meal for up to 4 weeks. To achieve healing, some patients may require additional therapy. Helicobacter pylori eradication. In combination with amoxicillin and clarithromycin for treatment of H. pylori infection and duodenal ulcer disease, active or history within past 5 years. 20 mg PO bid for 7 days with morning and evening meals. Take with amoxicillin 1000 mg PO bid and clarithromycin 500 mg bid. Gastroesophageal reflux disease. Healing or erosive or ulcerative GERD. 20 mg PO QD for 4 to 8 weeks. If not healed after 8 weeks, an additional 8-week course may be considered. Maintenance dosing, 20 mg per day for up to 12 months, shown to reduce relapse rates. Symptomatic GERD. Treatment of daytime and nighttime heartburn and other symptoms associated with GERD. 20 mg PO QD for 4 weeks. If symptoms not completely resolved after 4 weeks, an additional course may be considered. Hypersecretory conditions. Long-term treatment of pathologic hypersecretory conditions, including Zollinger-Ellison Syndrome. 60 mg PO QD initially, may increase to 100 mg PO QD or 60 mg PO Q12HR. Safety advice. Rabeprazole is not usually recommended because there is little information about its use during pregnancy. That's all the information about Rabeprazole we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.